Hello, today we're going to do tension pneumothorax for step 2 CK, step 3 and CCS. Tension pneumothorax is the progressive buildup of air within the pleural space, usually due to a trauma, which allows air to escape into the pleural space but not to return. It makes a one-way valve where air can go in but it cannot come out. Rapidly increasing pressure shifts the mediastinum and deviates the trachea to the opposite side. The increase in intrathoracic pressure decreases venous return, hence decrease in cardiac output. Patient going to present with chest pain, difficulty breathing, tachycardia, tachypnea, cyanosis. Any chest and cardiovascular disease can create these symptoms. So please check out for hyperresonant percussion note on the affected side, reduce expansion and decrease in movement. When the clinical feature and the physical examination points towards the tension pneumothorax and patient is collapsing, the best next step to do is a needle thoracostomy. For the education purpose, the X-ray is done from the posterior anterior view in maximal inspiration. Please also remember the rapid deterioration in a patient with mechanical ventilation should be suspected as a pneumothorax. Procedure and complication. Needle thoracostomy is done on second intercostal in mid-clavicular region. Remember, neurovascular bundle are located below rib. Complication. Intercostal neuralgia due to injury of the neurovascular bundle below or rib. That's the point to remember. That's why we put a needle on the upper border of the rib. If you unfortunately place a needle below a rib, there is a high chance you will hit that neurovascular bundle. Also, it can cause pulmonary or diaphragmatic laceration, bleeding, infection, pneumothorax if the procedure was done because of falsely suspected pneumothorax, rarely perforation of other structure in the chest or abdomen. After doing needle thoracostomy, now place a chest tube. Please don't forget to do a chest X-ray after a chest tube to make sure the tube is in the right place. Alright folks, this is going to be here for the step 2 CK and step 3 MCQs. All other slides from here are for the step 3 CCS. For the step 3 CCS, after doing physical examination, please click the order button, type pulse oximetry, monitor cardiac and blood pressure, oxygen, IVSS, normal saline, morphine, cardiac enzyme, EKG, and needle thoracostomy. Forward the clock. After the needle thoracostomy is done, now it's time for the chest tube. Click the order button, type tube thoracostomy. Forward the clock. After the tube thoracostomy is done, click the order button, type chest X-ray and basic investigation like CBC, BMP, LFT, urine analysis. Now admit the patient to the ICU. Forward the clock and the case will end. When the 2 minutes can pop up, counsel patient, reassurance, no smoking of no alcohol or no drugs if he is doing that all those things. Look for any vaccination and preventive measure due. You can click later and choose a date after a week or a month. Alright folks, that's going to be all for step 2 CK, step 3 MCQ and CCS. Please remember how to diagnose tension pneumothorax, and also please remember when the clinical feature and physical examination point towards pneumothorax and the patient is collapsing. The best next step to do is a needle thoracostomy. After needle thoracostomy, we place a chest tube and don't forget to do a chest X-ray to make sure tube is in the right place. Those are the points which are highly valued on CCS too. All right, that's for 8. Thank you.